because it's Suicide Prevention Month, I'm going to present this safety story at Visit HDC later this morning, and I thought it appropriate to share here as well. On August 28th, a 27-year-old veteran who gets his care here at Stratton attempted suicide. He was found by local police in a ditch, intoxicated with lacerations to both wrists and his throat. He was taken by ambulance to the Albany Medical Center with a blood alcohol level of 0.235. He had surgery by a trauma surgeon and was admitted to a medical ward on a 2PC involuntary admission and placed on a 1-to-1 sit. He had previously engaged with our facility for care in both primary care and outpatient mental health. He had an enhanced care flag for his suicide attempt previously in July of 2022. He had been seen on 2 occasions since then where safety plans were offered and declined by the veteran, and he failed to attend his last scheduled psychotherapy appointment on the 26th, that is the day before his suicide attempt, and had been followed up assertively by the provider following that no-show, but no contact had been able to be established. So on the afternoon of August 30th, so 2 days after he was admitted to the hospital, he eloped from Albany Medical Center, despite being on a 1-to-1 sit, and in part because of the outreach activities that have gone on over the last couple of years, the Albany Medical Center immediately called our suicide prevention case manager and notified us of the elopement. Local police were looking for the veteran, but the suicide prevention case manager here did the logical thing and called him, and he answered the phone and said, "Yeah, I'm at home." So while they were talking, the police were notified. The county mobile crisis team was sent to his home, where he was taken into custody under the mental hygiene law that allows local police to bring somebody in involuntarily, and he was brought to our emergency room and subsequently admitted to 10 Bravo. So the result is that because people had not given up on this guy and had already figured out how to deal with situations like this, he ended up, fortunately, in a safe place, getting the care he needs. And so the HRO principles involved include resilience and a anticipation of failure, if you will, knowing that if you don't succeed in engaging somebody at one time, you may need to find other ways to engage them in the future.
All right, thank you for that, Dr. Hauer. Real appreciate it.
Gino, it's Annette Payne. I just wanted to give a huge shout out to our Plattsburgh CBOC staff, especially Stephanie Breen, the nurse manager there. There was a very difficult veteran who presented there yesterday and caused some fairly significant disruption to clinic operations as well as some property damage. And the 2 social workers, Amy Ruger and Megan Lannon, as well as Stephanie Breen, worked tirelessly all day to provide good clinical care to this veteran in a respectful way, even though the veteran did not provide that same behavior. So just a huge shout out to Stephanie Breen and those staff, you know, and the good quality work that they do every day. And a shout out to our police and Chief Gibbons for also assisting in connecting with the local police to ensure safety of the staff.
Dr. Perrin, that was reported to me this morning. Echo your sentiment there. It is incredible to me that our collaboration between Albany and our CBOX and the local authorities to prevent veterans from, going overboard. This veteran in particular caused some damage to the facility there. And in spite of all the agitation from the veteran, the team there and the team from the local police were managed the veteran and were able to provide the health care that the veteran duly deserves. So I truly echo your sentiment there. Tremendous example of professionalism and care for the veterans.